Thank you. Good morning, and thank you all for joining us. This will be a little different than our normal COVID update. I want to share our plans to address the twin challenges before us: vaccinating our residents and getting our economy moving again. Since the state-initiated vaccine distribution, we have been working to develop and refine Denver's strategy to support deployment and the state's overall program. In short, our strategy is to expand capacity across all Denver neighborhoods to provide broad distribution of the vaccine and to ensure access to everyone in our community. We're taking these steps to build capacity and to identify places where vaccinations can take place with the expectation that greater quantities of the vaccine will soon be available. We do not have all the vaccines we need, but we can build capacity while waiting for more shipments. To build this maximum capacity and to leave no one behind, we will need to expand our reach and create seamless collaboration with many partners, including the state, private healthcare providers, nonprofits, and community organizations. Given the complexities of this task, we must treat the challenge of vaccination deployment with the same urgency we had when the virus came upon us in March of last year. And so with that said, I have ordered the reactivation of the city's Emergency Operations Center in order to ensure that all city agencies are mobilized to respond to the crises. Let me also be very clear about our strategy as this new year begins. Getting our residents vaccinated will defeat COVID and save lives. That must be our top priority, and the city government must be organized to support this goal. But the good news vaccinations brings is not enough to rescue and restore our city. The economic crisis brought on by the pandemic is going to be with us even after our residents are safely vaccinated. Restoring jobs and economic prosperity will take longer, but we also have to build our capacity for new investment and jobs. We need to get the strategy underway with equal urgency and the same sense of purpose brought to bear to save lives. Toward this end, I've asked my team to come back with a set of policy recommendations that will jumpstart our economy. We will discuss one program today, but in coming weeks, I will share more on the challenge of investment and job creation. To describe our strategy in more detail, and I am proud that I'm joined by three phenomenal public servants. Matt Mueller, our Emergency Management Executive Director, who will be talking about our forthcoming reactivation of the Emergency Operations Center. Bob McDonald, of course, our Executive Director of the Denver Public Health and Environment, who will be providing an update on our current numbers and vaccine distribution efforts. And, of course, Eric Haraga, our Executive Director of the Denver Economic Development and Opportunity, who will be providing an update on Denver's implementation of the state's 5-star program. With the priorities laid out in the President's American Rescue Plan, especially the focus around getting vaccines into the arms of the American people, we can finally see the light at the end of the tunnel. The President's announcement that states will see a 16% increase in vaccine doses starting next week, that the U.S. is buying 200 million more doses, and that we will start to get 3-week look-ahead reports. All of this means we really are at the beginning of the end. But we have a lot, and I mean a lot of work to do over the next few months. As distribution ramps up and more of our residents become eligible to receive the vaccine, the Emergency Operations Center will focus our current efforts and infrastructure so we can be as effective and efficient as possible at this critical time. That includes, as Bob will provide more detail on, how we expand broad-based access to the vaccine across Denver's various neighborhoods and locations where people are comfortable going to, and to address equity challenges in coordination with state, healthcare providers, and local partners. While we have every reason to be encouraged by the Biden administration's bold plan and action on behalf of our cities, we know federal aid alone will not boost Denver's transition from rescue to recovery. That is why I've challenged my administration to innovate efficient ways to create jobs and renew opportunities through our infrastructure investments and projects. Next, and another key point in our recovery efforts, we're announcing today that applications for the Denver 5-star certification program will open next Tuesday, February 2nd, at 10 a.m. At that time, businesses will be able to apply and become pre-certified in our program. Through our commitment to equity, we have put processes in place to ensure all businesses in Denver have the opportunity to participate in the Denver 5-Star Certification Program. A key component of this is our ability to evaluate which businesses are applying and getting certified and assess any gaps or barriers in real time. For that purpose, the first round of applicants will be capped at 500, and we will plan on opening round 2 within 2 weeks. I want to encourage businesses seeking certification to prepare before applying by watching the instructional video and completing all pre-certification checklists that are available. You can find that at denver5star.org between now and Tuesday. Again, that's denver5star.org, the number 5, denver5star.org between now and Tuesday. And I want to remind those looking to apply that Denver must maintain 7 days of stable or declining level orange metrics as defined by CDPHE before the program can be fully implemented, and pre-certified businesses can operate under level yellow limits. The good news is we're close with those metrics now, so things are heading in the right direction. Both of these actions, reactivating the Emergency Operations Center and opening applications for the 5-Star program, are important milestones in our work to move from rescue to recovery. Now, as we get more vaccines and more people get vaccinated, that light at the end of the tunnel gets a little brighter for everyone. But just because people are getting vaccinated doesn't mean we can let up on the things we've been doing to keep this virus at bay. So we got to keep wearing our masks, keep our social distancing, and keep doing things that keep our families, my family, your family, and those in the community safe from the spread. I'm going to turn it over now to Matt Mueller to talk about the activation of our Emergency Operations Center. Matt?
All right. Thank you, Mayor, and good morning, everyone. As the Mayor said, he has directed the city's Emergency Operations Center, or the EOC, to be activated in support of the city's vaccination efforts. By activating the EOC, along with the Joint Information Center, this will allow us to leverage the full resources of all city agencies and ensure efficiency and collaboration in our efforts. The EOC's mission will be to provide clear and consistent public information about vaccinations, ensure equity in vaccine allocation and access, mobilize resources, and ensure operational coordination of the vaccination effort between the city, the state, and our community and healthcare partners. Upon activation next week, first thing we'll be focusing on is establishing community partnerships and getting the vaccine into the areas of the city that need it the most. In order for the city to fully realize our vision, we need more vaccine, and we're hopeful that more will be coming our way over the next month. The EOC stands ready to oversee the city's deployment of the necessary resources and infrastructure to build our capacity and ensure we get the vaccine to those that need it the most. And now I'll turn it over to our Public Health Director, Bob McDonald.
Thank you, Matt. Good morning, everyone. I want to start where I normally do with sharing of some slide decks just to set the stage for our Q&A session. Bear with me for a moment here. We'll start by where we usually do, taking a look at those things that we've been looking at from the beginning of the pandemic. What's happening across the country? And I'm pleased to say that over the past few weeks, there's been a 35% decrease in COVID cases across the country just in the past few weeks. Now, we still have a lot of work to do here, and to the Mayor's point, we cannot let up. It has been suggested, and I've been asked, are we seeing the first signs of some type of herd immunity now, or some level of herd immunity, thinking that over 100 people potentially could have had COVID-19 when you take into account those that might have had it and have never been tested. And I would suggest that it is way too early to be thinking that way. We need to be diligent. We can't be thinking about herd immunity yet. I'm very confident we're going to get there a little bit later this year, but we need to keep up with face coverings and all of the public health controls that we've discussed from the beginning. When you take a look at the state of Colorado, again, we start to see some counties, including Denver, move from the red level phase to the orange level phase. We've been allowed to operate with capacity limits in the orange level, but we weren't officially in the orange level phase based on our metrics. We are there now. We are at under 350. If we can maintain that level for more than 7 days, then we can start implementing the flexibility that's provided through the 5-star program. You know, when I look at this map, we still have counties that are much less dense, much less populated than Denver is. And those counties in some cases still have over 1,000 cases per 100,000 people. A cumulative case rate that's much, much higher than Denver. So I think we've been very successful in controlling this in Denver. I want to thank all of our business sector partners for their high level of compliance, and our citizens. Hang in there, we're going to get through this, but that's what's driving these numbers down, is a high level of compliance. We need to continue to maintain that. Here is the epi curve that we've been looking at from the start, and you can see here now we just dipped below 350. 6 more days of that, and businesses that are certified can move into yellow level restrictions and increased capacity limits. So we're excited about that. We need to be careful. We're going to be thoughtful as we do that. If we start moving through the 5-star program and public health restrictions are lifted for those facilities and we start to see numbers ticking up, we'll have to move quickly to make sure that we do what's necessary to keep our numbers down successfully like we are achieving now. Back to the state style. This is as it's currently constructed, and you can see we continue to monitor the 3 main metrics here. The one that I get asked about a lot is that 2-week average positivity rate. And the question I've been asked is, you know, there's less people wanting to be tested now, more people setting their sights on vaccine. Is it possible that that positivity rate is lower because less testing is done? Again, with more testing, positivity rate goes down. Because
nothing. I'm listening to the press conference.
We tend to test more people that do not have COVID-19. So the less testing you do, generally positivity rate goes up. So this is actually a very good sign here with our positivity rate. Back to the conversation about herd immunity. We are not there yet. We cannot be thinking that way. We've got a long way to go. We currently receive about 8,000 doses a week in Denver. That is not near enough. You can see that with the allocations that we've had, we've been able to push those out a little bit quicker than some of our partners, both at the state level and throughout the country. But we are hoping for much more vaccine to roll in so that we can work through the tiers that are set up by the state. To that point, again, these are the tiers that are set up by the state. We are mandated to follow them, and we are working through this phase right here, 1B. Now, I acknowledge that, you know, it was communicated that those that are 70 and above are in this phase now. We can seek vaccine. It need to be communicated a little bit more that we don't have enough vaccine yet to serve everyone in this demographic. So we're hoping to move through this much, much quicker as more vaccine becomes available. I want to point out this area right here. There is a line that doesn't show up here, but it's somewhat provides guidance between these tiers, which I'll talk about here. When we look at the timeline for getting through the vaccination phase, you'll see here that phase 1A is completed, and we are in phase 1B right now, and you'll see this language here above the dotted line. That means above the dotted line means 70 and plus. Below the dotted line is when we start vaccinating frontline workers, teachers, and many, many others. But we're not there yet. We will be there soon, though. I want to spend a little bit of time here. You know, if I think of one word to describe our efforts through the pandemic, and even more importantly now through the vaccination phase, it is equity. It is the foundation for what we've been doing from the beginning, and it certainly needs to be the North Star on our efforts throughout the vaccination process. And we're working with all of the providers here to build a very, very robust network where there are points of dispensing through healthcare providers, through pharmacies, clinics. We are assembling and have actually started to deploy vaccination outreach teams to reach communities that can't reach us. And it's not enough just to think about, when we think about equity, it's not enough just to think about having many, many sites that people can access. We need to be thinking about using venues that people are comfortable going to, And we need to think about the registration process. You know, the pre-registration process is difficult for some. Some of members in our community don't have the tools to do that. They don't have the wherewithal to navigate through the pre-registration system. So we're working hard to remove those barriers, to get everybody vaccinated, particularly our most vulnerable populations, through all of the methods here, working with hospital systems, the state, as I said, pharmacies, private sector partners, community leaders, our partners at Denver Health and Hospital Authority. We will, in the very near future, roll out our plan and start implementing it as doses roll in. Vaccination rates will go up much, much quicker than they have been. I want to stress one other thing here. No one should have to pay for the vaccine. No one needs to pay. You do not need insurance. In some cases, I know that clinics or pharmacies might ask for an insurance card. That's because they want to bill insurance to get reimbursed, and then the federal government can reimburse those points of dispensing. But if you do not have insurance, that is not a problem. No one has to pay. You do not need insurance. And we will continue to send that message out, so that's made very, very clear to everyone in our community. So until we get to that point where we reach herd immunity, let's keep doing what we're doing with face coverings, social distancing, and hand washing. And with that, I will turn it back over to the mayor.
Thank you, Bob. I want to just reiterate one point, and I would ask the members of the media corps to join with us and please share this very important information that Bob just shared out. Not only our metrics, of course, those are extremely important, but the 2 points he just ended on. The vaccine is free. You do not have to pay. And I say that and underscore it because I know that is a fear point for many members in our community. And two, there are efforts to defraud people by suggesting they pay to help them get the vaccine. The vaccine is free. And the more we spread that information, the more we can protect individuals, particularly those who are in our older adult communities and our lower income communities. So please join with us in sharing that. And the second point I want to make, as many of us have joined in, and some of you may have participated or watched, observed our town hall meeting last week, there's still many communities who are fearful of taking the vaccine, distrustful, I should say. And we ask to please help us share the information that this vaccine is safe and went through all the normal protocols, though expedited, they still had to meet all the safety protocols necessary through their various trials to be brought to the market. So please join with us in sharing that. With that, we want to move on to Eric Haraga, Executive Director of Economic Development and Opportunity in the City of Denver. Talk about the 5-Star Program. Eric?
Great. Thank you, Mayor Hancock. Really appreciate you having me here today. We are excited to implement the 5-Star certification program here in Denver, as it really is a way to safely begin to reopen businesses who have been struggling to make ends meet through this pandemic. The program is designed to allow businesses that have limitations put on them due to public health orders to open at greater capacity, so long as they implement safety strategies above and beyond what is required by our current public health orders. We think this could be a real game changer here in Denver. The launch of this program could not have come at a better time, as more urgent relief is needed for Denver businesses. Last week, Denver received our latest unemployment figures from Colorado Department of Labor and Employment. Denver's unemployment rate increased from 7.2% in November to 9.3% in December. Implementing the Denver 5-Star certification program for some cases may mean the difference between a business keeping their doors open or closing them for good. It could also be the difference between a business laying people off or getting our residents back to work. As Mayor Hancock said, we are excited to announce that applications will be opening on Tuesday, February 2nd at 10 a.m. so we can begin pre-certifying businesses. Businesses should prepare themselves beginning today by watching the video and reviewing the checklist we have posted on denver5star.org. In order to become pre-certified, a business must successfully complete an application, schedule an on-site audit, and pass the audit. This and more information is available on the website. Materials are being translated into Spanish and Vietnamese and will be posted on the website next week before applications open. When building the program for Denver, equity has been at the forefront. We want to make sure that all businesses who qualify for this program have the ability to participate if they choose to do so. Next slide. So in order to help businesses prepare for the process, we are hosting 3 live town halls geared toward the business community. These town halls will provide a framework for what to expect as businesses prepare to apply, be audited, and then become pre-certified for the Denver 5-Star program. The first town hall will be on Monday, February 1st at 6 p.m. This event will be delivered in Spanish and will be hosted by Denver Hispanic Chamber of Commerce. My team at Denver Economic Development and Opportunity will also be hosting 2 town halls in English on February 2nd at 9 a.m. and again at 5 p.m. Invites and links to these events will be shared later today through social media, email, and of course at the denver5star.org website. Next page. So I would like to take a moment to really say thank you to our key partners and support organizations in the Denver 5-Star program. This was truly a public-private partnership. First, I'd like to thank Denver 5-Star Governing Administrative Committee led by Ellen Salazar and Elvis Brooks, and Council President Stacy Gilmore, our Economic Relief and Recovery Council, Visit Denver, H2 Manufacturing Solutions, Mile High United Way, and many more people and organizations. Your guidance and leadership have been imperative. And again, let's help our businesses get back on their feet, get our residents back to work, and begin reopening in a safe and health-conscious manner. So with that, I'll pass it back over to the Mayor, Teresa.
Thank you so much, Eric. Mayor, we're going to go ahead and start the Q&A unless you have any points regarding Eric's presentation.
No, I thought Eric did a great job covering it off. Thank you.
Fantastic. I had a texted in request, so I'm going to go with that first, and then we'll get to the rest of our press pool. Chris Vanderveen from Channel 9, go ahead.
Mayor, thanks for being here. Thanks for taking questions. My question is in relation to, do you think it was a mistake for the state to be overly reliant on providers and pharmacies to do the bulk of the distribution when it comes to vaccine and not have sort of a centralized one-stop location where people can go to find information? We have a lot of people that are sort of hopscotching from provider system to provider system looking for vaccine. It's very difficult. Do you think it was a mistake to go the route that we're going?
Not necessarily, Chris. Let me share this. You saw us start off with a huge testing facility at the Pepsi Center, and then ultimately moved to break it up because we recognized that not everyone was able to access that testing center, and that we needed to go and as best we could meet people where they work in neighborhoods. And so, grocery stores, pharmacies are certainly in our neighborhoods. As you get more on the local level, you also still find there's some food deserts that exist. So not everybody has access to the large healthcare systems, grocery stores, even pharmacies. And so that's where I think this is where we come into play. The local governments come into play with our partners to try to get into those areas of town that are underserved and perennially overlooked when it comes to these type of opportunities. And so as you heard Bob and Matt and Eric all talk about equity, that's what we're focused on, is how we can go in, set up smaller efforts to get people vaccinated in those neighborhoods so that folks aren't overlooked and quite frankly don't have access to the vaccine. So we're working to remove barriers. I think the state's plan was a good one, but I think when you add local governments into play, you find we're going to get even better in breaking down some of those barriers and getting people who are oftentimes overlooked.
Chris, thanks. Let me take one from the general pool now if you have a question.
Hi, this is Esteban over at Denverite. Can someone provide a little bit of a timeline for the application process? So if the application process starts next Tuesday, when could a business conceivably start operating under that yellow level? Is that 2 weeks from then, pending the metrics aligned with the program, or can you just provide like a little bit of a picture of how that program will be processed?
Yes, I'd be happy to take on that question. So at Tuesday at 10 a.m., the portal will be open. So we are taking companies first come, first serve at that point. The applications get processed. Complete applications will go on to a site inspection. And we already started training our first personnel last week to conduct these on-site inspections. There's a major caveat to this, and Bob had mentioned that we're really tracking that 2-week cumulative incident rate. The state's approval of Denver was conditional of Denver being in all 3 categories in the orange on the state's dial system. So, and we have to continue those metrics for 7 days. So we haven't gotten that full approval from the state. So we plan on having those applications, conducting those inspections, queuing up, and in essence pre-certifying until we get that letter from the state and we're approved to fully approved on the 5-star program.
Hey, this
Thanks,
is Conrad.
Go ahead,
over
Conrad.
At the Post. I had a quick question for Bob. Can you give us just a little bit more insight? I might have missed something on whether Denver will directly receive vaccines from the Biden administration and how priorities are being set for vulnerable populations. I know you said you're really focusing on equity, but can you dive into a little bit about how maybe people experiencing homelessness might be able to get the vaccine?
Yeah, great question. Thank you. So allocations go from the federal government to the state government to the state health department, and then we work closely with the state to weigh in on where we think the allocation should be distributed. That decision is largely made by the state at this time, but we're working with them to keep an eye on how the allocations are being used and if modifications need to be made. I want to go back a little bit to the question about the state's model. It made sense, I think, for the state to start allocating to hospitals first, because when you look at the tiers, in Tier 1A, that's healthcare workers. So it was largely the first phase, healthcare workers vaccinating themselves. Now we need to work with the state to see what that distribution should look like. To your question about how do we vaccinate our most vulnerable, including those that are unhoused, that is going to be through the use of our vaccination outreach teams. So we have about 6 or 7 teams, I believe now, that are assembled that will be going out, vaccinating those within our shelter system, those that are not taking advantage of the sheltering system. That's how we're going to reach them.
Conrad, thanks. I'm going to go to Liz Gilardi from Channel 7 for the next question.
Teresa, let me just add something before we go.
Go
to
ahead,
Liz,
Mayor.
That's okay. That was a great question, and Bob, thank you for that answer. One of the things I want to remind the media is that I have joined, along with other mayors across the country, in requesting from the Biden administration to distribute vaccines directly to the cities for the various reasons that both Bob and I have just discussed. Our ability to get to those who are going to be hardest to get vaccine, or who have the greatest levels of barriers to get the vaccine, we have a greater ability to do that. And so we're still working with the Biden administration to make that happen. We're still hopeful that we'll be able to do that. Go ahead, Liz.
Hi, I have 2 questions regarding 5-star. The first one's for the mayor. You mentioned the unemployment figures, how devastating this has been to our economy. How vital do you think 5-star will be in kind of getting the economy back up and running?
I think it's critical. I mean, a lot of the workers who are in those facilities right now, if they're working, they are working at reduced capacity, obviously. I'll tell you, and I'm sure Eric can comment on this, many of us have had conversations with people who run restaurants, who work in some of the taverns and bars in our city. And when we went from 25% capacity and had to close back down because of our increased numbers around the holidays, they realized at that time, they said, we were actually, while it's not where we needed to be, 25 was at least allowing us to continue to take care of our employees and keep our businesses at least able to stay open. And so the ability to go from 25 to 50 is huge for these operators, and it gets more people working. So it is critical to the recovery of our economy. Obviously, the more people working, the more people are in those places safely and buying and enjoying themselves, the more energy that's generated. Obviously, sales tax receipts are generated, the stronger we become as an economy.
Thank you. And my other question was, you talk about businesses having to go above and beyond and training these new inspectors that are going to go in. what are some of the specific things that they're going to be looking for?
I'll let Bob or Eric respond to that one.
Sure, I'd be happy to start that off. So there are more stringent requirements. Right now, it's recommended for employee symptom checks, for example. This will be required. It's a little bit different depending on the industry, but for gyms, to get the benefit from going up from 25 to 50 people, depending on the square footage for a gym, it's very beneficial, but it would require a reservation. You can't just walk into the gym like you would and check in. You would have to have a reservation. There's a lot of requirements under ventilation. There's a specific ventilation checklist you would have to go through, and different notification procedures should there be exposure. So there's probably a list of 30 or 40 things within the state guidance, and you'll see that plus maybe a few additional items within the Denver application.
And I was wondering, too, you talk about 500 businesses in this first round. I don't know how many registered businesses could be eligible in the city of Denver, but any idea, is that like a fraction? I mean, how many businesses are we talking about are eligible in this first round?
Yeah, so that's a really good question. And I gotta say, no one really knows for sure. We'll get a good idea when this portal opens. Plus, there is a link for businesses that want to inquire about the program. We looked at our NICS codes, or industry codes, to see how many eligible businesses we think there are. There could be about as many as 7,000, but we do not know if it'll be 10% of 7,000, 20, 30, or 40% of 7,000. So that is an unknown, I will say.
Liz, thank you. I want to give somebody else a chance to also ask a question. We've got Gabrielle from Fox. Do you have a question that you would like to ask?
I do. Thanks, Teresa.
Sure.
My question is for Mr. McDonald. Just wondering how closely the city's health department is watching the emergence of these other variants that we're starting to see pop up in the U.S. now, and how much of that played a role when it came to the city deciding to go ahead and launch the 5-star program now?
Yeah, well, certainly, it's a great question. Thank you. So I think just about everybody is aware that, you know, these viruses, coronaviruses and other types of viruses, it's not uncommon for them to mutate. That is not new. This particular variant that's recently been identified is more infectious, but it's not more severe. It's not more deadly. It could drive up cases. We've had a few cases here in Denver, but it has not been identified as being widespread through the city. But the bottom line is, you know, with whether it's the 5-star program and more allowances for businesses or keeping the variant in mind, bottom line is we're going to watch data. And if data kicks up for any reason, we're going to react quickly. I also want to stress that the vaccines that are in place, not only are they safe, they will take care of this new variant strain. There's no concern there. So we need to get people out and get them vaccinated as soon as we start having more roll in from the federal government.
Gabrielle, thank you for that question. I want to give Seth from the Gazette a chance if you have a question, Seth.
Yeah, thanks, Teresa. Kind of piggybacking on both of Conrad's questions from his questions from earlier. Talked about vaccinating the homeless communities. Can you talk a bit more about what focusing on kind of hesitant communities means, vaccine hesitant communities, what efforts will be going there? Then, Mayor, you mentioned you're still working with the Biden admin on the letter and request you sent. What does working mean? Can you kind of expand on that and where that's at? Thank you.
Let's start with the mayor on that one. Mayor, if you would weigh in.
Sorry, having a little problem with the system here. Good question, actually. I remain working with the Biden administration. First, we made the request, and obviously we just remain in constant advisement and conversation with the administration. I'm one of about 36 mayors who've made the request, obviously one of the larger cities who've made the request. And so it's really just continue to consult with the administration through our various pockets of leadership in the U.S. Conference of Mayors, as well as giving feedback information as necessary, as they requested from us, from Denver, from other cities around the country.
And Mayor, do you want to talk also about just the outreach that we're doing to individual communities of color and other folks who, I think, just the way that we're going to connect people to vaccines and get shots in arms around the city?
Well, absolutely. And I think Bob has alluded to some of this. With the focus on equity, we recognize we want to meet people where they are. We want to go where they feel most comfortable and where, quite frankly, the barriers are the lowest. And in places, including their churches and other places of worship, and various community-based organizations that are out there that people recognize and respect and trust are going to be critical. And so we're reaching out to them now. We're helping to connect them with the public health officials, including Bob directly talking to ministers, pastors, and in process of potentially setting up drive-through sites that they want to do not only for their parishioners but for the entire communities, working directly with community-based partners who, again, are recognized. So Bob is doing it. Of course, we have UC out there doing a phenomenal job in what they're doing, as well as Denver Health and Hospitals doing their work to help remove and lower barriers to communities that, again, are overlooked. So we're working very closely with them and to build trust. And, of course, last week we did a town hall meeting with some African-American trusted faces and voices, including physicians and community historians and journalists who talk about their own experience. And we're going to do the same thing with the Latinx community and the Asian community and the indigenous community to, again, lower the barriers, bring out trusted faces and voices, and get people to understand that, one, this vaccine is free, but it's also safe and should be taken as soon as you are allowed to.
Mayor, I'm going to ask Bob also to give some context, Bob, if you would, around, our control or limited control over supply, because the question about people experiencing homelessness is a critical one in terms of the way the levels are set and our control or lack thereof over that process.
Yeah, happy to do that. So as I said earlier, our vaccination outreach teams will be going to shelters, going to those sites in Denver where we have people experiencing homelessness that are not using or taking advantage of the sheltering system. We will do that largely through our vaccination outreach teams. I want to step back and just add one other thing regarding just stressing the importance of reaching out to our most vulnerable. As the mayor directed and mentioned earlier, the opening of the Emergency Operations Center, the Office of Social Equity and Innovation through Aaron Brown's leadership in the mayor's office, they will be embedded into that process. So the decisions that are made under Matt Mueller's leadership and the Emergency Operations Center, that entire group will be embedded into that process so that as those decisions are made, we're making them thoughtfully with our most vulnerable in mind. Yeah, again, the vaccination outreach teams using multiple ways to communicate from this office, from the Joint Information Center, from community leaders. We know that we need to, that people receive information and their level of comfort varies. So we need to take a multi-pronged approach to get that information out. And that's exactly what we're doing.
And I do know, though, that Bob, and I think it's important to state that, you did submit a plan and request to the state to move people experiencing homelessness up on the priority list. The state knows that that is our intention and what we're hoping to do.
Yeah, thank you for that, Teresa. That's exactly right. We've made that request. We understand that the tiered system can be complicated, and when we modify it at the local level, you can get on a slippery slope, and then you have to worry about, well, how's that compared to the surrounding communities? But we continue to have conversations with the state about any flexibility along those lines.
This is Esteban again.
Thanks, Bob. I just wanted to make sure I got to that part of the question. Hey, Esteban, let me give a couple of people a second to answer real quick, okay, to ask their questions, and unless it's a follow-up on that topic.
Yeah, it's a follow-up on that topic. I was just hoping you can expand, like, what exactly are these vaccination outreach teams doing? Are they kind of vaccinate people on site, or are they just reaching out to get information about vaccinations in the future?
Yeah, no, thank you for that. No, it is actually a team. In each one of these vaccination outreach teams, we have people who can help with the logistics. We have a driver, we have medical personnel who actually administer the vaccine. We're working very closely with our partners at Denver Public Health. They're doing great work with their vaccination outreach teams, getting out. It's actually going out to those locations where most vulnerable are, setting up there and vaccinating them there.
Oh, wow. So there are people being vaccinated at shelters and then in some of these camps? Like, is that what you're saying?
That's correct. Yeah, I can't stress this enough. We knew this from the very beginning, that we need to go where people are. And we need to do it in a way that they're comfortable. We need to get out to them, and that's exactly what is currently underway, and we're going to keep doing that.
I want to give Vinny from Bloomberg a chance. Vinny, if you have any questions for any of our participants.
Yes, Teresa, thank you. This is Vinny Del-Giudice at Bloomberg News. Have there been any cases in Denver of people cutting in line, if you will, to get the vaccine? And does Denver have authority to sanction people who cut in line, misrepresenting their age for health conditions, et cetera? Thank you.
Well, I guess I can take that question. You know, we recognize that this tiered system is largely based on the honor system, if you will. We want to make sure that we don't set up systems that create barriers by asking for too much documentation, asking people to prove that they're in that tier. We want people we want to remove those barriers. Now, there is some information that is just absolutely necessary to get the job done. We need a name, and we need generally a date of birth. But that's about all the information that is collected. And the reason that that's collected is because we want to make sure that when that person shows up for the second dose, we can compare it with their first visit. We can see that we actually had that we had the right person before us. They're getting the right dose. Remember, the first dose you get has to be the same type of dose for the second administration of that. And then we check date of birth to make sure that they're in the right tier. But again, also even more so to verify that we're doing this safely for those that are lining up. You know, I've anecdotally heard that some have gotten vaccinated earlier than others, but I think that's very limited. And I think there have been maybe some extenuating circumstances where vaccine might have been left over. There was nobody else that was aligned to get the vaccine. We don't want to waste anything. So there are those types of situations, but very, very limited.
Are there any plans or any strategy to sanction people if you catch somebody doing that?
Well, I certainly hope we don't have to do that. I don't anticipate getting to that point. If we start to see that more and more, then we would work very closely with all of the partners that we're working with to see what systems can we implement to stem that tide without, again, building barriers that keep people from getting vaccinated. So we'd have to explore that if we started seeing more of that. I'm confident that we won't.
Thank you very much.
Vinny, thank you. Ed from the DBJ, do you have anything you want to ask?
Yes, thank you. I have two questions. One of them is really quick and technical. The 350 number that we have to get below for 2 weeks, is that a hard 350 or is that 350 per 100,000 residents?
That's 350. It's a cumulative case rate. So let me explain what that means. You take all of the case numbers that you had for the last 14 days, you add them up, and you divide by 7.2 to adjust for so you get that case rate per 100,000 people in Denver. So it's the number of cases per 100,000 people in Denver. And when we get to 350, that's the threshold. 350 and less, we are in the orange phase.
Thank you. The second one is kind of probably more of a question for the mayor and Eric. You mentioned capping the first round of five-star applications at 500 businesses when we've got potentially 7,000 that could apply. Why are you capping it at 500? And are you worrying that doing that could disadvantage some businesses by a month or more versus some of their competitors if they get the five-star application early if the process gets backed up?
Eric, you want to go first?
Yeah, so there's multiple reasons for us to cap at 500. One reason is equity. As we get the data in pretty immediately, starting next week, we will be able to determine what industries are underrepresented. Are there any neighborhoods that are left behind of our 78 neighborhoods? we'll be able to see if the application process needs to be adjusted and if it's created barriers for some of our communities, especially communities of color. We'll be able to provide that technical outreach. The mayor had mentioned in his comments that we would plan on having a second round within 2 weeks. As you can imagine, even if we didn't have a cap of 500, it will take some time to process. This program requires on-site inspections. We have 150 square miles here in Denver, 78 neighborhoods that we'll have to take a look at. So once we get this data from the first 500, depending on how it looks, within days, we may be able to say, you know, we kind of missed the mark. For some reason, gyms were undersubscribed. We could do a targeted industry, maybe additional round for that within a few days. Or it could be we missed out on certain neighborhoods or other particular groups. So we're trying to be flexible and try to be nimble. I don't want to steal words from Bob's mouth, but I think there's also a concern that we need to do this in a measured way, in a health conscious way. So doing this in rounds will allow us to really look at the case data and see, where the numbers are in terms of COVID. So those are several reasons. I'll hand it back over to the mayor.
Hey, well said, Eric. I think it's important to note this is not a hard cap. This is for assessment and evaluation that Eric just pointed out. We need to make sure we do this in an equitable manner. And this is what cities, great cities, do if they want to really take care of her people and to recognize that there are neighborhoods and businesses, quite frankly, that don't have the same means in which to move as nimble and as fast as some have the ability to do so. So we want to make sure that everyone gets a hit at this and it's allow for us to assess and then go back out with a better informed situation. And let me say this as we get ready to wrap up. I'm sure that's what Teresa's going to be doing momentarily. We're at over 9% unemployment. That's a real number. We have not seen those numbers since 2010, which means we're going to have to look at these numbers as extraordinary as they are and then work to respond in an extraordinary manner. And that's one reason why I asked the team to go back into the laboratory as we did in 2011 when I became mayor and say, what do we need to do to jumpstart this economy? And we came up with a recipe or a plan that allowed us to do that, to jumpstart our economy. We're going to have to do the same thing here. It's going to have to be a combination of public sector efforts, creative, innovative steps, as well as the private sector meeting us where we need to go in terms of helping to turn the economy around. We can do it because we've done it before, but it's going to take everybody to think creatively and innovatively, and that's what I'm looking forward in terms of the recommendations from the team. Teresa?
Hey, Mayor, I did promise one additional question, and I also was hoping before that we could clarify the timing of these vaccine outreach teams, because I want to make sure that we're clear that they're not out yet, Bob, correct? Okay. And what the timing will be in terms of their deployment.
Yeah, so again, we actually do, in partnership with Denver Public Health, we do have some vaccination outreach teams that are actually going out doing vaccinations now. When we get certainly when we get more vaccine and we get in through the different phases, we will send more of those vaccination outreach teams to the field.
Perfect. And final question, I know this was off topic, Mayor, but I wanted to let Chris Vanderveen ask one additional question.
Mayor, your office is obviously appealing a decision made by a federal judge that would compel the city to give a heads up, essentially, when you go in and clean up a homeless encampment. Is one of the reasons why you're fighting that is that the city is a bit loath to give a heads up to the cleanups and encampments when the city knows that by doing so, you're going to inevitably have protesters at that location? Is one of the reasons why you're fighting this that you know that protesters are going to show up?
And Chris, great question. Here's the reality. We do look at the judge's order as a pretty dangerous order for the city of Denver, not only for the general public, but for the individuals who are in those encampments, who are living in those encampments. Because if there is a public health threat, we need to be able to move in as quickly as possible to abate that public health threat. There is no other public health situation where we are required to give advance notice to move in. Our job is to protect the health and safety of all residents, whether they're living in encampments or they're not living in encampments. And we don't have a situation, you could be in a restaurant where we have a public health threat. We need to be able to move in and to abate that public health threat before we have a larger problem. So there's no other situation where we're required to do that. The ruling sets a pretty dangerous precedence in which we don't believe makes a lot of sense when it comes to abating a public health threat, and that's why we are appealing.
All right, Mayor, thanks for taking that final question. I appreciate it. And thanks to all of you for participating. Mayor, any final words before we let him go?
No, thank you all for participating. I think we've said all that we need to, but we're happy to follow up if there's any additional information you need.
Absolutely. Please feel free to reach out to me or our office, and we'll help facilitate any future questions. Have a great day, everybody. Thank you.
Take care.